Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and the revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental improvements to achieve their moonshot. And today, I'm delighted to be welcoming Dr. Eric Topol, both a colleague and a friend of mine. He is the founder and director of the Scripps Translational Science Institute and the executive vice president and professor of molecular medicine at the Scripps Research Institute. He's also a well-known author of many clinical books on cardiology, but probably best known for his two seminal books, The Creative Destruction of Medicine, which, by the way, was only 2013, that's 4 years ago, and The Patient Will See You Now, which was 2016, and they both seem like a lifetime away, despite the fact that it's really just around the corner. So, Eric, thanks for joining me today. It's a pleasure to have you.
Oh, thanks, Nick. I'm so appreciative of you having this conversation with me. Yeah.
So let me kick off. I think if I was to describe one of your major sort of driving elements of the things that you think about and, you know, really trying to push for, aside from the digitization of healthcare, it's really the inclusion of patients as partners in the delivery of care. And I think we all recognize, or at least most of us recognize, that as a sort of central tenet of the future. But how do we get there? I mean, you've been talking about this. You wrote 2 books about it.
Right.
But it still feels like we're some way away. How are we going to get to that point of getting these patients engaged in this clinical care system?
Well, I'm glad you brought it up because it's probably the thing I'm more passionate than anything, and that is getting people their data. I think until we do that each person has all their medical data, we're not going to be able to move forward in a substantive way. So an incremental thing would be that every doctor encounter, the doctor would give the patient either hand give them or ideally electronically send them their note and all their notes and all their labs and their scans and everything. So we need to engage people. They need to feel, each person, that they have ownership and control of their data. And we already know from studies that the more they are into it, the better their outcomes are. In fact, amazingly, even in some cancer studies, we're having people with cancer having their data, they did better than a lot of these really expensive drugs for prolonging their survival and improving their outcome.
So actually, I just want to pick up on that. That's news to me. So what you're saying is that actually having patients with their own data was an improvement in the outcome from cancer treatment?
Yes, a striking impact. Multiple trials, I mean, there are 2 now, where they tested a control group versus those who had all their data, and they actually did better. They had better survival, and that just shows you the impact of being fully engaged. And I know it's far bigger than just one disease state. It cuts across all of medicine. And unfortunately, because of medical paternalism, there's great reluctance to do that. And there's fears of things like the anxiety of a patient reading descriptors about themselves or suing or all these things. But we already know from studies like Open Notes and others that, in fact, doctors are much more willing, in fact, excited about giving people their data because it reduces the number of contacts. It improves the well-being of their patients.
So I clearly am in your camp, but one of the things that I hear repeatedly from physicians and physician friends is, and in fairness, when I receive my clinical notes, I've got deeper insights. I spent time in medical school. How do we bridge that divide of comprehension? I mean, I think sharing the notes, almost all of the experiences from my clinical friends has been positive, as you described. But the challenge is that a lot of that information can't be processed by the majority of people because it contains all of this complexity and language and understanding of medicine. are there approaches to help deal with that?
Well, that's a real key issue, which is the sense among doctors like us that patients can't handle the truth or can't handle the jargon. But they do really quite well in looking things up and basically translating it. But also, I think what you're getting at is we could do much better as far as language in our notes that are widely understood, rather than the medical jargon like cryptogenic and idiopathic and all these fancy words. We would do far better if we communicated in English. So there's a couple of things there, but for the most part, the more patients that I've spoken to that say that doesn't matter how complex the note is or even an article they want to review, they can teach themselves if need be, if they're motivated.
Yeah, it would make an interesting study to actually get to the bottom of why we use some of those terms. I mean, I know when I went to medical school, Latin was one of the it wasn't a requirement at the point that I got there, but it was for earlier generations, and I think we started to use that, and it was helpful to me. But I think you're right. Maybe we need to move away from these complex terms. One of the things I heard you say, and I think is important, is that access to information, and it's not just the own personal record, but the access to the internet has opened up our capabilities. It's no different to the younger generation who essentially move to Google at any point in time when they don't understand something. So explaining is not necessarily the challenge. It's some of the terminology that's maybe too complex and we're making it difficult. As you think about patients, so one of the challenges I have repeatedly with patients is that they say, oh, I don't want to. I just want to be told what to do. I just want to get the treatment and move to the next sort of step in my health journey. How do we help them get more engaged in this complex care? We can't get them engaged in their financial well-being to invest in their pensions. How are we going to do that with healthcare?
Well, I think we can appeal to people that this is far more important than their financial state, because without this, they may not have a financial state. Now, with respect to the issue of is this for everyone to be really be deeply involved with their own data? No, some people, they don't want any part of it. But I think the public needs to know that we are in the midst of in the U.S., terrible overuse of medications, of procedures and operations, so much that's unnecessary, wasteful, inappropriate. And so it's best to be involved to know whether something that's being recommended is unnecessary or could lead to, incidental findings and all sorts of problems. So that's why I think the level of trust can be really promoted by people being more involved. So yes, it won't be for everyone, but hopefully we can increase. And all the surveys that have been done to date suggest that at least 70 to 80% of the public really want to have their data and have a very active role, much more than they have today.
So that's certainly been my experience. I mean, I find the more that you engage people, and partly that's education and the sort of systems that we have to really help them understand the value of that. And obviously, you and I both share a common friend, Leonard Kish, who highlighted the value of this patient engagement. And the two of you actually wrote a really interesting, I don't know if paper is the right term, but certainly a proposal around the concept of blockchain as a tool to help manage and control, and in particular to ensure the trust elements, securing that data. How do you think there's some scope for the inclusion of this technology to help sort of expand this sharing of data in a way that allows me as the patient and you as the clinician to have a much more trusting relationship for that data sharing experience?
Right. Well, Nick, that paper, indeed, that was in Nature Biotechnology. It was called Unpatients. And in that, we highlighted the fact that people need to own their data And one of the problems is there's not a good, secure place for that today because remember, it's not just the electronic record, which is, of course, there are many of those for any given individual, but also now and more people are generating their own data through sensors or even labs or getting their genome or their microbiome or all sorts of new fields of data that they didn't have before. So we need a home for all that data. Today, it truly is homeless. And so whether that's through a private cloud or blockchain, we need a technology that supports that because more and more in the future, people need to have all their data. For example, if we're going to do deep learning and artificial intelligence to try to prevent illness or guide people how to manage a chronic condition or to have the optimal treatments, we need all their data. Not just one electronic record from one health system that they happen to be in right now. So this is a big issue. Another problem that, of course, you're well aware is that the number of mistakes in electronic record is pitiful, and they just get perpetuated from one encounter to the next. Because 80% of the notes in these hallowed electronic records are cut and pasted from one to the next. It's unbelievable. And we don't even respect patients enough that they know the truth. They are the ground truths. And they should be correcting and editing these mistakes about diagnoses they don't have, medications they don't take, and on and on. So this is what we have right now is, this pitiful electronic records that are so fragmented, incomplete, and wrong. We have to do better than that.
Yeah, I think I've quoted you many times over this concept of the validation of the record. I mean, the idea that I don't get to see it and check it. I think ePatient Dave is the sort of poster child of, finding erroneous information. So sort of including them in that process and just dissipating this fear of, protectionism around this information that, historically we put in content that we want to share. And, I don't see that as appropriate. You brought up another interesting sort of direction around here, and that's all the wearables, all this additional data. And I know you were sequenced. You were one of the very early players in that. I went through 23andMe and then did a full genome sequence. I'm a big fan of wearables and the inclusion of all of that data. How do we get people? I mean, I see the value in it. I think it's still a struggle to see where it's going to go, and I accept I'm on the early part of that curve. But for me, without that information, it seems like we're practicing medicine in the dark. How do we get people to sort of move on to this more continuous, ongoing monitoring, capturing that information and then including it in the medical record?
Right. Well, here again, there's some problems. Doctors are largely dissing these sensors. With the exception perhaps of some family physicians and internists that might support diabetics who are on insulin to take the sensor or chronic continuous glucose monitoring. But otherwise, most of these other sensors, whether it's for heart arrhythmias or sleep apnea or blood pressure, so many things, they're not been embraced by the medical community. So it isn't like when you go to the doctor, you're advised to download smartphone apps and get these sensors that could be helpful. We're still living in this counting step era of sensors, which is so far been transcended by, really very worthwhile medical grade and FDA approved sensors. I mean, so for example, you could monitor your heart rhythm continuously through a smartwatch today, FDA approved. But you don't see many cardiologists recommending that, no less other doctors. So there's going to be more and more of these going forward. And I think rather than people being like a quantified self where they're using all sorts of sensors, the idea here is very narrow use of a sensor that would help manage or help prevent a condition that you have. So we basically want to use this in a very careful way rather than in any kind of promiscuous way. But, for the most part, these sensors are pretty inexpensive, but there is another issue, and that is the data flow. How is that all stored? How is that processed? These are some things that we haven't grappled with because, again, you want to see that coalescence of traditional medical data with this new form of data flow.
So for those of you just tuning in, I'm Dr. Nick, the Incrementalist, and I'm here with Dr. Eric Topol. Thanks for joining me today. So Eric, I think important point that you brought out about some of this additional data. It's not just, hey, let's capture everything. And I think where you were sort of leading or advocating was actually more of a sort of prescribable or focused capture of that information. So I think we've started to see, I've certainly seen evidence of apps that are prescribable. So it's no longer I'm prescribing a medication or a procedure, but actually digital prescriptions. Have you got some examples of that?
Oh, sure. I mean, I think the idea of prescribing more apps and medications and deprescribing is, I find myself every week in clinic. That's kind of my main function, is deprescribing and finding apps that will help. So one of the most important things is high blood pressure. And most people don't monitor their blood pressure enough, and they're not very well controlled, or they think they are and they're not. But if people have a smartphone, connect with one of these wireless cuffs, and even now, there are watches that are FDA approved that you can use. But the point being is that you can get frequent blood pressures, especially at times when you might not otherwise get one, like when you're in stress of traffic or an argument with one spouse or all sorts of other times when you never would go get a blood pressure cuff. And all of a sudden you've got 10 measurements a day. And now we know what's really going on. And what's really fascinating is to find patients where their blood pressure is great all week, but the only time it's a problem is Monday morning when they go back to work. And so why are they taking these medicines, 3 drugs every day, when there's a one-day issue? And we have had this notion, that we give drugs out like candy, and we never have thought about, well, what is the real world of each person? And what is it about that person that we can, work around their needs from a medical standpoint? And it's these apps and sensors that are helping us do that. And it's going to become much more, like, for example, why would you go to a sleep lab and have, for example, Medicare reimbursement of $4,000 where no one would have a normal sleep study? I have yet to see a person have a normal sleep study in a sleep lab. Why don't you do that at home in your home bed with your smartphone app? By the way, that could be reused, and every doctor who sees patients with possible sleep apnea could be using that and going on from one patient to the next of oximetry during the night. And that would not only save a lot of money, but is far more convenient and physiologic, real world. That's what we're missing today, is people in their own environment.
Yeah, so I mean, obviously, as a frequent traveler, I couldn't agree more. I mean, sleeping in a sleep lab would be, in my mind, very similar to sleeping in all these hotels, and I know I never sleep terribly well. So, very much the medical home and enabling that as part of the sort of technological innovation, I think, is going to be an essential part of our future. We don't have a lot of time left, so I want to sort of focus a little bit on the system side. And one of the things that I constantly think about is, our healthcare system is this massive, complex, challenging connection of all these areas. And anytime you try and fix a piece of it, so we say fee for service is a terrible thing. So we'll move to value-based care, and then how do you? And there's all of these, and I know you've looked at this, and it ran as threads through all of the things that you both post and describe and articulate in your books. Can you see any sort of starting point of changing our system? What could we do? What is is there a? I don't believe there's a silver bullet, but there has to be some steps we could take that might start to change our system to get value for money, which I don't think we're getting out of this 18% GDP that we spend.
Right. Well, of course, there's lots of solutions, none of which have yet worked. putative solutions, I should say. But I think the biggest one is getting each person involved far more. So, for example, as we talked in the beginning of our discussion about the fact that a third of the medical care is waste, and it isn't care, actually. It's actually doing things that are wasteful. So if every person knew that there was something that was being ordered by a doctor was actually not right for that person. Like today, if I were to say, what was the one thing we could do, incrementalist, right? That no cost, and would save potentially billions of dollars a year and save people's radiation exposure, would be every patient who's going to be ordered to have an ionizing radiation scan, whether it be a CT scan or a PET scan, a nuclear scan. They should ask the doctor how many chest X-ray equivalents is that, and really see. And if they find out, as they mostly will, that by the way, that nuclear scan is equivalent to 2,000 chest X-rays, how many people will want to go ahead and do the test? And the answer is very few. So when people are educated, as that example, which we should, as the incrementalist, I recommend we start that today. Then we start to chip away at all this profound waste, and that's a starting point at least. I mean, there's many other strategies, but that one I think is a winner.
I love that. I mean, I think the central tenet is that education and engagement, and making, right. One of the things that I know as physicians, when you look at the spectrum of care that we decide on, particularly around end of life and, life-saving activity, physicians all decline the majority of it, whereas patients all ask for the majority. The only common thread is pain relief. And that's because we're better educated and understand the consequences of those decisions and, the failure for much of that. And we've got to impart that. So I love that. I really like that sort of idea. So we've got a couple of minutes left. I have one quick question. Any more books in our future for you?
Yes.
There is? Okay, I'm excited to hear that.
I am working on one currently, and hopefully it won't be too long. And let's say it's going to be getting into the whole world of artificial intelligence in medicine, and I've got some, hopefully, what will be considered interesting perspectives, some controversial. We'll see how that is received in the months ahead.
Fantastic. I'm excited to hear that, and I know everybody listening in will be as well, so we'll look forward to that. And then you obviously get huge amounts of exposure. It's very clear. Is there anything in the technology front that's coming down in that you've seen, you really think is just going to have such a huge impact? And you could pick something like genomics and say it's going to revolutionize our world, but I'm thinking more of the sort of devices or some kind of incredible innovation that you've maybe seen that you think, wow, that's just a different way of looking at things, and may really change the way that we deliver care.
Well, no, I think it goes back to the point you made earlier, as from Leonard Kish about the patient is the blockbuster of the future. I think that if we were just to work from that front, with you being the incrementalist, that would be great. But I do think that deep learning as a subtype of artificial intelligence is going to be. It isn't just about the genomics. It isn't just about one's microbiome or various sensors. It's pulling all that data together. That's what's essential, and that's what I think will be the big difference in the years ahead. And because we're complex people, our systems, and they need to be all integrated. So we'll get there eventually.
Okay, so Eric, it's been a true pleasure. It always is. I love just hanging out, learning from you, sharing ideas. So thank you for joining me today. For those of you on the line, do you have any better ideas? Or have you found a small incremental change that's brought about a big improvement in your world? Let's continue the conversation on our hashtag, The Incrementalist, or share it with me at Dr. Nick1 on Twitter. You can find out more information about the show on our program page at healthcarenowradio.com. I'll see you guys next time.